Hi, my name is Vanessa Price, and today I'm going to be taking some knee measurements. I'm going to start out with some passive range of motion knee flexion. So I'm going to have my patient supine lying on her back. And what I'm going to have her do first is just to see what she can do actively. So go ahead and bring your heel towards your butt. Okay, and now that we see what motion she has got on her own, we're going to go ahead and do it passively for her. So I'm going to push her heel as far back until I get to the end feel, which for this movement is either firm or soft. She does have a soft end feel with the calf hitting the hamstrings. And we're going to have her hold this position right here. I'm going to take my goniometer. Our axis is going to be the lateral condyle of the femur. We're going to have our stationary arm pointing down towards the greater trochanter in the midline of the femur. And our movement arm is going to be down the midline of the fibula, tibia, down towards the lateral condyle, lateral malleolus. So I'm going to go ahead and place my goniometer. And she does measure at 133 degrees of knee flexion. Normal is 135, so she's right there in the range. Now I'm going to be taking a passive range of motion measurement of knee extension. So I'm going to have my patient supine again. Pelvis is stabilized by body weight. And then we have a bolster in order to allow hyperextension of the knee, if there is any there, and also to just have it stop the table from preventing normal extension. So I'm going to take my goniometer and place that first. Our axis is going to be on the lateral condyle of the femur. We're going to have our stationary arm pointing towards the greater trochanter down the midline of the femur, and our movement arm is going to be pointing down towards the lateral malleolus down the midline of the lower leg. My hands are going to be on the proximal tibia fibula and the distal femur. And then I'm just going to apply direction down towards the table and get as much extension out of the knee as we can. Okay, and I'm getting a measurement of -2. Normal for extension is 0, so she does have 2 degrees of hyperextension. Now I'm going to be doing some manual muscle testing. I'm going to start with my patient in prone, lying on her stomach, and I'm going to test the semitendinosus and semimembranosus, which come from the ischial tuberosity and insert into the medial tibia. So it does cross the knee and allows for knee flexion. So we're going to place her into about 50 to 70 degrees of knee flexion. We're going to have her hold that position. I'm going to stabilize the thigh, and then I'm going to put her into internal rotation. So we're going to put her hip into internal rotation there and have her hold this position. I'm going to try to pull you into extension, okay? Don't let me pull you. I'm just going to pull straight back, down into extension. And 1, 2, 3, 4, 5. Good. She was able to resist strong pressure for the 5 seconds, so I'm going to give her a 5 out of 5. Okay, now I'm going to be testing the biceps femoris, which is another hamstring muscle. It's going to come from the ischial tuberosity as well and insert into the head of the fibula on the lateral side of the knee. We're going to place her, she's going to be prone, like she was for the semitendinosus and membranosus. Place her into 50 to 70 degrees of knee flexion, and then we're going to stabilize the thigh here and place her into external rotation at the hip. So that way we're making sure we're isolating that biceps femoris. And I'm going to go ahead and pull straight back into extension again. Resist me, don't let me pull you. 1, 2, 3, 4, 5. Good, you can relax. Again, she was able to resist strong pressure, so she's going to receive a 5 out of 5 on that test as well. Okay, now I'm going to be performing a muscle length test of the rectus femoris, which is one of your quad muscles. What we're going to do is have the patient prone. We're going to stabilize the pelvis right about at the posterior iliac crest with a belt. And then we're going to go ahead and place our patient into a passive range knee flexion. So we're going to stabilize at the thigh. We're going to grab the distal tibia fibula and go ahead and push her into as much knee flexion as we can. So go ahead and hold there for me. And I'm going to take my goniometer. It's going to be the same landmarks as we did for knee flexion before. We're going to place the axis at the lateral condyle of the femur. Our stationary arm is going to be down the midline of the femur, pointing towards the greater trochanter, and our movement arm is going to be pointing towards lateral malleolus down the midline of the lower leg. This measurement is going to read about 125 degrees. Go ahead and compare that knee flexion measurement that you just recorded to your original knee flexion measurement And if it's decreased, that's going to indicate some tightness or shortness of the rectus femoris.